Hi guys, welcome to this special episode of Skin Talk by Dr. Naidu. I put up a status on my Instagram asking you all to send questions about hair transplant. And let me tell you, you guys didn't hold back. We have tons of questions. Some of them are too specific, few are interesting, and some they just made me laugh out. So let's not waste time and get straight into it. Okay, here is our first question from Dr. Frez asking what are the complications of hair transplant? Great question, Dr. Frez. This hair transplant is an extremely safe procedure. Yes, it has got few complications like a bit of bleeding, mild swelling, or at times even infection. That is if the right aftercare is not followed. In case you choose your doctor right and do not fall for someone random practicing this hair transplant, or even the technicians doing it left and right, then it's all good. Here is another question from Mithun and Raz asking, what is the age criteria for this hair transplant? Is there any particular age limit? $1 million question, guys. Technically talking, this hair transplant does not have a particular age criteria. In fact, most of we doctors advise you to wait till your mid-20s or later, because this is when your hair loss pattern stabilizes and also the results are much better. So in case you found one hair on your pillow at your 18 and planning for this hair transplant, then no, it is not for you. Another question from a fellow dermatologist, Twinkle, asking, I'm in third year residency of dermatology. From where can I learn this hair transplant? Hi Twinkle. It's great to see other dermatologists also showing interest in hair transplant. Now there are many workshops and certified courses that you can take. And also shadowing a senior dermatologist is another great way to learn. I mean, that's what I did in my initial days. And trust me, that made a whole lot of difference. Also keep an eye for your conferences and training programs that also you can take. Shaurya is asking, is it painful? Okay, Shaurya, it is not that painful, so don't be scared. The initial prick with the local anesthesia, that is mildly painful, but post that it's quite a smooth sail. In fact, most of the patients, they binge watch Netflix series throughout the procedure. And as I always say, if you can survive a leg day at the gym, you can survive this too. Next question is from, I ate the guy who ate my egg. Really interesting username. Going back to the question, can hair transplant be done at 50s or 60s? Yes, absolutely it can be done, but there are few criterias. Like the donor area, it should be all healthy and dense, and also the patient should not have any major health issues. In that scenario, we can perfectly plan for this hair transplant, and also the patient at 60 can rock the look of head full of hair and still look like 30s. Here is a question about female hair transplant from Divya, asking, can females get hair transplant done? Yes, Divya, definitely females also can get hair transplant done, and it is just not a guy's thing. In fact, there are more and more females who are opting for this hair transplant of late, whether it could be for more defined hairline, big forehead, or thinning patches. It is totally possible. Next, we have Misuba asking, can hair transplant be done onto the upper forehead, closer to the scalp, so the forehead looks smaller? This one is interesting. Technically, yes, hair transplant can be done at this hairline, so it moves down and the forehead looks smaller. But again, it needs to be done with a lot of caution. Why? Because the angle, direction and density of hair should look very natural. Otherwise, it will have a very wiggy look. And also, once this hairline is lower down, there is no going back. So make sure you have a detailed consultation before opting for this. Raj is asking, will the transplanted hair fall out after a while? Well, Raj, there is nothing to worry, because in this transplant, we take grafts from the safe zone, that is from behind the scalp, and these hair follicles do not undergo this DHT hormone-induced thinning. But however, this initial shedding is commonly seen post-transplant, because this is when your hair follicles are all resetting and planning to grow out. So do not panic if you see little shedding post a hair transplant. Annamalai wants to know, will my hair look natural post a hair transplant? Literally, this is one of the most common questions in my DM. And the short answer is yes, 100%, but only when it is done by a skillful doctor and with the right technique. This created hairline, it blends beautifully with your natural hair. And anyhow, it's your own hair that we take it from one place and put it to another. And once this hair grows out, you can oil it, cut it, style it, and no one will ever know. This is how natural it looks. Next, we have a funny question from Dinesh. Will this hair transplant affect my brain? Okay, Dinesh, I just love this question. Yes, it might look like we are drilling into your skull or into your brain. But this hair transplant is a skin level procedure. We are only working on the outermost layer of your scalp, and this is where the hair follicles are. In fact, there is a solid skull and multiple protective layers in between your scalp and your brain. So there is nothing to worry. At the end of this procedure, you'll only get a better hair and not any brain damage. Mithun is asking, will the transplanted hair fall out? Okay, let me explain you. Around 2 to 4 weeks after the transplant, most of this transplanted hair shaft will fall out. And you will be like, oh my god, what is this? But don't worry, this is totally normal and expected. The hair roots are still inside your scalp and they will grow out. And once they grow out this time, they are permanent. That's because we are taking these follicles from behind your scalp. And these follicles are genetically resistant to balding. That's a good news. Vasant is asking, will the donor area grow back again? Technically, during the transplant, we are taking this hair along with its root. So no, it does not grow back. But this donor area itself is like so dense in most of the patients. And also, while extracting the grafts, we do it in a very scattered pattern, like here and there. So there is no baldness or patchiness. The percentage of extraction is important here. Like we go on an average of around 30 to 40%, making sure to leave the rest of the hair behind. So this donor area is not sparse. Alright guys, it's time to end our session. I had a great time in answering all of your interesting questions. See you next time. Take care.